So first of all, I just want to say I greet you, Apostle Kwe. Thank you so much, Pastor Ben, for giving me this opportunity. Mr. Chiame Mame, Deaconess Rosemary Kaislaughter. I greet you all and thank you all for all these listeners who are watching me right now. And I just want to say, every individual, you particularly sitting on the screen and watching me right now, I just want to thank God for your life, because we are celebrating Easter now. We can see when we look at the death toll, people have died. Last time I checked the death toll in UK, it's about 10,000 people. It's not like we are better than those people. The disease could have hit any one of us. So I just want to take this opportunity to thank God for your life, because the disease we have seen, it knows no color, it knows no age, it knows no qualifications, and it knows nothing, no qualities you have. And therefore, the disease can attack anyone. It can attack. When the disease first came, it only affects the elderly. But I need to be underestimate say, oh, yeah, mammy penny phone one pay and your boss only on your own deeds 50, 16, and yank. To see a researcher man who said, Yariana only paying on your prayer, you could be. Now, before I start, I just want to say, I'm not a medical doctor, I don't treat patients, and I'm a virologist, meaning be a study virus, and I'm not a microbiologist, meaning be a study different microorganisms, which is if you have bacteria, parasites in my name. And I'm an epidemiologist. So my doctorate degree, my acquired, my study the biology of the human body, from the tip of the hair to more. My study in profound research expertise in medical scientific topics. And now the last few years, what I've done, let's say, last few years, I study immune cells, particularly those attacking the skin. So immune cells in autoimmune dermatosis. So in the last few years, most recently, my last project has focused on immunology. And therefore, I'm happy to bring to you and explain certain things regarding the biology and the immunological aspects of the disease and the pathogenicity of this virus to you. We heard death toll now, 80. So mainly it was attacking the elderly. So people thought, say, oh, for your immune system is low, it's affects you. But recently, who said, I cried with this 6-week-old affected, I'm a training. Recently, there was a child in France, 16-year-old girl. She lost her life. She was healthy. She was moving back and forth, and she died of COVID-19. Most recently, there was a pregnant woman in the United States, and she was in the 33 weeks of her pregnancy, and she had very severe symptoms of COVID-19, and so she was hospitalized. And during her hospitalization, she was in coma, and because she was pregnant 33 weeks, they had to induce labor. So you see, this virus we're talking about is not to be played with. Do not say you are healthy, you are the most healthiest person, and you have everything. Exercise. The virus can track anyone down. Please, let's not underestimate this virus. It is very, very dangerous. So when we say coronavirus, what are we talking about? So coronavirus is actually a family of viruses. Now recently, because as you see a virus from AI is a coronavirus, it's not a diba coronavirus a virus different but recently, because the other before coronavirus, we didn't know about them, and they didn't cause a pandemic. But could be about a group, a family of viruses. So what do this group of viruses, what do? They cause, they affect the respiratory, which is lungs, minimum, and will trachea, lungs area, or no more affected. And so now, these coronaviruses, they cause respiratory diseases. And because they are family, back in 2002, but could be by a friend, SARS virus. And they causes, it causes severe acute respiratory syndrome. And about 2002, and so it affected a lot of people. So this was particularly dangerous as well, but we didn't hear much of it until recently. So when we say coronavirus, we are not talking about one virus. We are talking about a group of viruses. But the one that has recently emerged is called COVID. It causes COVID-19, which is coronavirus disease. and it was identified in 2019, hence the name COVID-19. But what is it caused by? Now let's get in detail into the biology of this. So when we talk about what it's caused by, it is not just caused by a coronavirus. As I said, this is a family of viruses. It's caused by particularly the cause we are experiencing now. This is SARS-CoV-2. The about 2002, and only a friend of SARS-CoV-1. Because coronavirus 3 baby, when a virus, say, which type of virus is this? We know it belongs to the coronavirus group, but how different it is. And almost and then they find a lot of things when your friend is SARS-CoV-2. Yes. And this SARS-CoV-2, like I mentioned, virus be bad newer. The most important thing is you have to know where is the virus, what is the genetic similarities. See, virus be bad, you say, and if a virus is free by it, what is the origin of the virus? And when we think about it in greater detail, no one really knows how the virus emerged. The origin of the virus has remained unknown to all of us. We do not know how the virus came about. All we know is it was reported back then in January that this virus has similarities. So who said virus no abano, and for company free buy. And who said virus no the genetic sequences information containing in the virus no. Na 96% similarities. My friend of horse bats in tree, a friend of apine. Almost okay. Send 96% then potentially it's possible say virus not because China in the past no more use bats as a more traditional medicine. It's more live market. When you go to their live market, the Chinese they have these live bats. And therefore, because some of them, they use it to prepare traditional medicine and foods. And so people assume, say, if it has this 96% similarities in the horse bats now, then it may have transmitted from the bats to humans, which is from bats to humans, and then pass on from human to human to human to human. So this is the initial thoughts as to the origin of the virus. And so a bit potty a free buy idea, ABC and no being into be an adjoining and account. Now, virus by almost okay, a share similarity to say the mechanic to horse bats. Into right now, no can say the written and the proven knowledge about the origin of the virus roots back to this horse bat, all because they found out that this virus that is affecting a lot of people shares 96% of genetic similarities to horse bats, and therefore we have rooted to the bats. But as to where it came from originally, how it happened, this is unknown to the world. And when a virus comes like that, so the virus we know it has come out, how is it going to cause disease? So virus dia would the way or benefit or now we check coronavirus now say around as a name be so it has the spikes on it. And research has shown that there are certain proteins expressed on the surface of this virus. And this is what allows it to infect our host cells. Inti protein be a was animal virus na de be no. And no and researchers inform me at say a quote the benefit be ma and name be no and in a bet bind it to your body. So in the next question say a bay and never bind it to. So this is the next question we ask. What is the virus when it comes to our body? What is it going to bind to? And now we have found out that it binds to a certain receptor, IFN APE2 angiotensin receptor 2. So that receptor is expressed on the lungs, not only on the lungs, but on the heart. In people who have hypertension, coronary heart disease, who are at risk because virus, they are only causing damage to your lungs or say causing damage to your heart. Now, what brings me back? When the disease first emerged in China back then, there were 41 patients. They reported to have been infected with this SARS-CoV-2, which is the virus causing COVID-19. And what they found out was 5 of these patients, when they went to the hospital, they didn't go because they had sore throats or they are coughing or they are having other respiratory symptoms. They went because of heart tightness. This is almost sign at the core said were infected. Now come about peri blood pressure cost so crample. It now was sure that our sack or someone seen how did it happen? Not once a virus not been up bind it said kind of bind it to these receptors, not only on the lung, you know, but they were command into a product not because the ministry and also no, they went because of heart precipitation. Now come about peri and those people don't quite. So this shows the virus here we are talking about a very, very serious virus. To say, imagine, once studies reports here, they show that most of the people who were hospitalized, now or church tightness, from cardiac arrest, while on hospital tested positive for COVID-19, into which they say, anyone who have any problem with your heart, this receptor is expressed on the lung, like I said, and also in your heart. And therefore, most of the people that are hospitalized, they also have myocardial injury because biomarkers can be found in their bloodstream and in your yama. And therefore, this is not a virus we have to play with, I would say. We have to really, really take this virus very seriously. And I quite remember, I think when the virus emerged in Wuhan back then, and there was a study that showed that they were tracing who was the first person to be infected and how did it spread. So they were using video camera, also CCTV camera. There was a man who went to a vegetable market. And when he went there, he was at the same spot with an infected person for 15 seconds. 15 seconds. And you should imagine, within this time, you could be infected. And there was another couple, so a woman and a man, and they went to the clinic. Now, clinic, no, at some point in time, they were in close contact with another infected person. And it took them 50 seconds to be infected. So you should imagine the pace now virus the travel. You cannot estimate how fast the virus travels. And therefore, I was saying we have to practice social distancing. And I was saying this at one of the platforms that I was given the chance to talk about, that social distancing is very important. Most people, they think not going out, not going into public gathering, as in a party or a church, that is social distancing. No, social distancing means anyone not living in your household. It's social distancing now. And and you know to say a neighbor or to next building. Sample for Michelle, I would say 1.5 to 2 meters. Why? Because it's a kind of past studies shows a virus travel at a rate. And now, if about December 2019, we have April now. It is just a short time that so many people we don't understand fully yet what is happening. And therefore, the virus now. What do we know about it? So your quite more details are about the transmission now. Which the young said kind one just face will be one virus. Now, how now between virus? So how can you contract this virus if you do not practice social distancing? And research has shown that the virus can stay on paper for 24 hours. You understand? Until now, recently, when you go to supermarkets in Germany and elsewhere, they put a sign there that if possible, you can pay by card. You know, but if it's not possible, obviously you pay cash. But the research has shown the virus can stay on paper for 24 hours. Until within this time, you take it, you can rub your eye, your nose, your mouth, and you have this virus. This is the port of entry for the virus. And research has shown that it can stay on plastic for 3 days. 3 days, the viable virus, which is virus or the live virus, it can stay on plastic for 3 days. On metals, and then which say obi post my baby mia na so oba no bo bunisa no mia so a we na so pia bontia uso mu akotiti wani ana so okoso wano you can contract the virus. And so the fact that it can stay on metals for 3 days shows that this is a virus we should not underestimate its pathogenicity. Recently, I don't know if you all heard about this cruise ship that was the Diamond cruise ship. And when they have evacuated all the patients, all the people from the ship, they could identify the RNA of the virus 17 days after. Now, I have to say, the RNA of the virus doesn't necessarily mean that this is a viable virus. It just shows that the virus was still present on that cruise ship 17 days after. Like I was saying, this is not a virus we have to play with. We have to take this very, very serious. The pathogenicity of this virus is just beyond our understanding. And as we are right now, we know so little about its transmission. What we know now is that from person to person, and it travels through droplets. And these droplets that I'm talking about, you can contract the virus if someone breathes on you. So you can practice this. You have a mirror in front of you, and then you breathe on the mirror. You can see that there's some droplets. You produce some sort of fog. These are respiratory droplets that you don't even see it. So practice it right now. You can stand in front of a mirror or a glass, breathe in and breathe out. You see you produce a fog. This is respiratory droplets. And this is the droplets that transmit the virus. And you see, you can breathe on somebody without even seeing the droplet, and the person can contract the virus. And that is why you have to hold this distance. You understand what I'm saying? This is why it is so important. And if somebody can breathe on you, and now not anyone who has symptoms. So we have people who, when they are contracted the virus, they start coughing. Some people have, as research has made us understand that the virus first attacks your upper respiratory tract, and then it goes lower. So when you have dry cough and all that, and some people eventually develop pneumonia. And some people may be infected with the virus, but they never even ever notice that they were ever sick, and the body clears the virus out of their system. Some people, like I repeat, some people get the virus from somewhere, they go outside, they never ever get any symptoms at all, and their body clears without them even knowing. So they never noticed that they are walking around, they were ever sick, they ever had COVID-19, and they have recovered. So these people we call asymptomatic patients. Asymptomatic because they are not showing symptoms. They have the virus, but they are not exhibiting symptoms. So we term them asymptomatic patients. And then we have those people who contract the virus. They start coughing, they can't, they have difficulties in breathing, they are sneezing. These people are the symptomatic patients. And then recently, this is just new information that came last week, that they have the so-called pre-symptomatic patients. These are the people who don't develop symptoms, and then later on, they start developing symptoms. And then the asymptomatic, they don't develop symptoms at all. So once we have the symptomatic patients, those who eventually show symptoms as in coughing, sneezing, and pneumonia, and all that, in between, we have the so-called pre-symptomatic patients. These are the people who have contracted the virus, but they never showed any symptoms until a few weeks later, they start developing cough and sore throats. These are the pre-symptomatic. And then here we have the asymptomatic. They never showed symptoms throughout the course of the disease. Now, what do we know? The people who never showed any symptoms, asymptomatic, several studies have shown that they have high viral load. What does that mean? This means these people within the upper respiratory tract, they can transmit the virus the most. They don't have symptoms, but the virus has replicated a lot within their other part here. So these who are not, the people you are working with that you think, oh, he's fine, he's the most fittest. I don't know if that's how you say it. This person, they don't have the virus. If that person, saw virus now, show virus ne part of state. Now only sample by through talking, breathing on a person, they can pass the virus on to another person. And so these are one thing we have to really take serious, because if you don't practice social distancing, someone can breathe on you, like I said, and you can acquire the virus. And yes, so about the transmission, about the virus, we know, like I said, that they pass on from person to person through the droplets. And emerging information has shown that The virus is also detectable in stool specimen. It's detected in stool specimen. And so if someone has used the toilet, they don't wash their hands, before they touch the flush, it's still sitting on there. So it's in stool specimen, the viable virus, it's in stool specimen. And therefore, this is why it is very, very important, and I cannot stress enough how important it is to practice social distancing and a good hand hygiene. Wash your hands frequently. So that's why we mostly talk about, people that are living in the same household, that the level of transmission there is so high already. Therefore, when you see person outside your household, so be on your native, hold the distance, because if you are more okay, but one good distance no be neighbor be obvious. Oh, wait, madam, for any share what you want to say. No, tapuna Betty, only a month or two. There or the virus now without you even knowing. Now, if the person has passed the virus onto you, this asymptomatic patient has passed the virus onto you, maybe you may not demonstrate any symptoms, but think about it. You may have passed it on to your grandma, your little sister, or another person who could develop severe symptoms leading to death. This is why we have to take it seriously. If you are not sick, I'm talking to you, right? If you are not sick, you may harbor the virus in you. You may pass it on to someone who may also not develop symptoms, but they may also pass on to another person who can develop symptoms that can be severe. And so it's very, very important that we hold this distance, because like I said, we have seen that the virus, it doesn't respect personalities, it doesn't respect politicians and the rich people. We have seen recently the Prime Minister of UK was infected. Many people have died. A professor in Ghana who was doing a lot for the nation died recently. This virus can strike anyone down. So if we are here today and we are sharing this knowledge with each other, then we have to thank God. We have to pray that God continues to protect us, and most importantly, we have to add a little precautions. God is protecting us. God is protecting. Like I said, through this Easter, we have seen that we are victorious. We are victorious over coronavirus. But I want every individual listening to me to add a little precautions. Please wash your hands and please hold the distance, because you may not be sick. You may not be sick, but you may harbor the virus, and you could pass it on to your grandmother and send them to an early grave. Maybe it was not their time to die yet, but you just give them the ticket to the grave. Please, let's take it seriously.
Good. Dickness, Doctor, God bless you for the education and then the teachings on the virus, COVID-19. We will soon give chance for people to call us and then ask questions. Once you are there, you can help us. And I can see a lot of us are following us on live Facebook, and then others too are listening to us. Now, but before I open the chance for the viewers to ask questions, I want you to highlight a little bit on how fast the virus can affect others. You talk about the fastness, some 15 seconds, 50 seconds, and then they are attracted. And so, what do you advise concerning the social distance? So, we are living together at home with our wives, our children, and the family is living together, and the social distance, so far as you are concerned, I understood to be maybe our neighbor or those that we are not living together with. And so, how fast will the virus attract our family members, maybe taking it outside and then bringing it inside? How fast will it attract them? You talk about flashing the WC, and how long will the virus stay on the plastic material before it dies? So when somebody goes to the WC and then the hand touches the handle of the WC and things, what do you advise, and how fast would that affect us?
So regarding the pathogenesis of the virus, mentioned it can stay on these surfaces. And so let's say if somebody has touched your your door handle or the flash on the toilet, you touch it, you don't wash your hands, and then you give the virus a code of entry into the body. It has been reported that most people start developing symptoms 5 days after, but the virus can be detected in them a couple of days after as well. But they start developing symptoms 5 days after. And so I think the immunity of every individual also determines if you're able to see the symptoms ahead or not. And yeah, so it could take up to, the virus can work in a person, they can stay on the surfaces. So on metals, it's the metal stays 3 days. So within these 3 days, the viable virus that can cause infection, it's there. Therefore, if you touch it and you just put it in your nose somewhere, you can infect yourself. But we have been, recent findings have shown that there is an exponential decline in the viral rates of the exponential rate of the virus. And so let's say somebody touches us right now. The viral load right now as to day -1. So let's say the next day and the next day after, within the 3 days, is going down gradually. And so if you have come in contact with this, it's not like somebody sneezed on you who has coronavirus that you eventually develop it straight away. You need a substantial amount of infected viral particles that can cause the disease. So it's not one mini droplet and you're sick straight after. You need a substantial amount of infected droplets from an infected person to develop the disease. And once the virus enters your body, most people, 5 days, they start developing symptoms.
Okay. You talk about asymptomatic patient and then a pre-symptomatic patient. I want you to make the difference, the difference very clear to us, or draw the line for us, so that if somebody is asymptomatic patient and then pre-symptomatic patient, because you talk about those who overcome the virus without even knowing it. I want you to throw more light on that, and then I'll open the line for people to call to ask questions.
So every individual has a way of how their immune system, into the way of their immune system, so just feel infection, more fighting the immune system. Every individual's immunity is different. So how patient A ever responded to a virus, how patient A will respond to a virus is different from how patient B will respond to a virus. So the way the immune system is built varies from person to person. And so when certain people come into contact with the virus, the body somehow clears it without them noticing it. This all depends on how your immunity is. The body fights kakra, and so yare kakra, and somehow you develop cold and coughing and runny nose. So yeah. So I just want to go back to the 3 different classes of symptoms.
Yeah.
We have the asymptomatic, like I said. So first of all, you should know, before we go into, you should know that your immune system will determine the outcome. How your immune system is. That's why it's very, very important for people to eat healthy, because there's no treatment to coronavirus right now, like a cure for it. It's just everything is dependent on how your body will fight it. And therefore, eating healthy and getting all the vitamins, the necessary vitamins required will help your body fight it. And so how your immune system will fight it, yes, 1, the asymptomatic. These people come in contact with the virus replicates in them, it's in their upper respiratory tract, they breathe on you when you're talking, they expose infected droplets, that could be large droplets or small droplets as minimum as 5 millimeters, and they never develop any symptoms. Their body somehow, the immune system is able to deal with it without them ever showing that they are even sick. You can only find out if they were infected if you do an antibody test. That will determine if they have antibodies running through their bloodstreams that fought the coronavirus. These are asymptomatic. Their immune system is in a way that it fought the virus without them ever noticing. They don't even know themselves. And how can these people find out they've even had COVID-19? They can find out by doing antibody tests eventually if this becomes available, which is companies are developing these tests right now. And so these people, they never know they're ever sick. They never find out because the body cleared it because of the way their immune system is. And we have the pre-symptomatic. These people never develop any symptoms. And at some point in time, they start coughing, sore throats, and then they develop mild symptoms. These are called the pre-symptomatic patients. So before this recently came out, and before World Health Organization only categorized between asymptomatic and symptomatic. And then they followed these patients up, and they found out those that they categorized as asymptomatic, some of them eventually developed certain symptoms. And this is why this new thing has come as the pre-symptomatic. They never had symptoms at the beginning, they were fine, and at some point they start coughing or sneezing, and these are the pre-symptomatic. So this is all how the immune system is. And one could argue, why is that? So this is a long answer that could go in various angles, because right now we have seen that if a person is infected with the virus that is from Norway, and another person is infected in Germany and Paris or America, it's the same coronavirus, but the virus has, with time, it has changed a little bit of its information. Virus no, obi or Ghana when you COVID-19, you compare obi or Germany and also obi or USA. Nina coronavirus here, and as a SARS-CoV-2 can was it, but we train genetic information in ma was some and therefore this could argue say why the person eventually starts, have they come in contact with another virus, developing symptoms. And so this is the virus is doing this, a gradual changing, very, very minimal, that they have compared and they can see, okay, it's similar. It's not like you're gonna fall sick again, but it's very, very similar to what it was. So it's the same virus that we're talking about worldwide, but if you go in detail, if you look at Germany, people who brought it from China, and even the community spread, there's a gradual mutation of the virus. And so this is an extended explanation of this pre-symptomatic phase. And we have the symptomatic phase, those who eventually develop the symptoms. So they're infected and the body tries to fight back. You start coughing because the virus has bound to your goblet cells in the lungs. It's filled with fluid. How can you get rid of the fluid? The body is trying to fight it. That's why you're coughing. So because what the coronavirus does, they attack your goblet cells in the lungs. And these are cells that are preventing mucus buildup in your lungs. And so when it attacks it, it destroys it. And then these things build up in the lungs. And your body thinks, okay, now these things are in your lungs. How can I get rid of it? You start coughing. You start bringing mucus out. This is why your body's reacting. So this is a symptomatic patient. So like I said, symptomatic, pre-symptomatic, and the asymptomatic. And the key to all is, please, let's eat healthy. Let's eat healthy so we can be strong, because our body is built in a way that it can fight all these viruses, but we have to keep it healthy. We have to eat well, get all the vitamins we need to help boost our immune system and fight the virus.